Many jobs and hobbies require excellent vision at near, intermediate, and distance. While glasses and contact lenses can allow for focus in most ranges, they can also be a hindrance. And as our eyes change naturally over time, even the best prescription lenses are unable to provide the sharp vision that we enjoyed in our youth. Imagine being able to see the alarm clock and having an easier morning routine. Imagine not needing glasses to read, check email, or see the speedometer in your car. Imagine seeing distant faces on the beach, or playing golf, tennis, or even swimming without the inconvenience of contact lenses or the constraints of glasses. Hi, I'm Dr. Andrew Shatz, and I'd like to thank you for choosing SightTrust for your vision correction experience. This video was designed to explain how SightTrust Eye Institute can reset, refresh, and renew your vision. The motivations for cataract and refractive lens implant procedures can include difficulty driving at night or in poor weather, frustration from contact lens intolerance. You just can't wear them as long as you used to. Fear for personal or family safety in crisis situations. You don't want to have to worry about not being able to see in the event of an emergency. And interference with jobs and hobbies. You don't get to enjoy them the way you wish you could. Whatever your unique motivations are, the one common desire is to see and feel young again. As you watch this video, consider your own motivations for vision correction and seeing more clearly. Imagine, what would life be like if you were no longer dependent on glasses or contacts? Just picture it in your own daily routine. Your eye's like a video camera with two lenses that are meant to provide a clear view of the object you're observing. When light enters the eye, it's focused by the clear dome-shaped cornea and the lens before it lands on the retina, which is your eye's film layer. The young, healthy lens can change shape to adjust between near and far vision. Refractive errors occur when the cornea or the lens do not properly focus. Nearsightedness or myopia is caused either by an eye that's too long or by a cornea that's too steep. The effect of nearsightedness is that distant objects appear blurred while closer objects are in focus. Farsightedness or hyperopia is caused by an eye that's either too short or by a cornea that's too flat. The result of farsightedness is that objects near and in the distance may be blurred. In astigmatism, the cornea or the lens are shaped more like a football than a basketball. Objects are not focused into a single image, and vision is blurred or distorted at any distance. Astigmatism often occurs in combination with myopia or hyperopia. Presbyopia is the inability to see near objects without glasses, even when distance vision is clear. This condition starts to become apparent to most people in their 40s. Presbyopia occurs as the natural lens inside the eye begins to harden and lose its ability to change shape to focus on near objects. Finally, a cataract is a clouding of the natural lens that results in vision that's dull or dim. This can be compared to looking through dirty glasses. In addition, light from bright objects such as headlights can create halos and glare. Cataracts begin to form in our 50s and can make activities that were once second nature more difficult to perform. Driving at night or in inclement weather, reading in poor lighting, and sports such as golf and tennis can become less enjoyable even with mild cataracts. If left untreated, the visual effects of cataracts continue to worsen. As we'll see later, the appropriate time to have lens renewal surgery is now more dependent on your individual visual and lifestyle needs rather than any specific objective measurement of your vision. Cataract is the leading cause of reversible blindness worldwide. In the United States alone, millions of cataract operations are performed each year. Modern lens renewal procedures are safe, quick, and painless, and can help you regain a sense of confidence that will allow you to return to the life you want to lead in a matter of hours rather than weeks, even if you don't have cataracts. If you've been told in the past that premium IOLs would not be suitable, you actually may still be a candidate. Premium IOLs provide excellent visual results and, in combination with laser technology, can provide you with glasses freedom that you desire. Although there are some who may not be ideal candidates for certain IOLs due to the health of their eyes, most people can qualify for this exciting technology. During lens renewal procedures, a laser creates a microscopic opening and gently divides the lens into small segments, which are then removed from the eye. Next, a lens implant is inserted in folds and seats itself in place. An antibiotic solution is then used to hydrate the edges of the opening, allowing them to fit tightly together without the need for sutures. Laser cataract surgery has revolutionized the delivery of accurate, precise, and safe results. And combined with multifocal implants, the percentage of patients achieving glasses freedom has greatly improved with this technology. While traditional cataract surgery has been an effective treatment for the last several decades, it does have drawbacks. Ultrasound energy causes swelling in various parts of the eye, which can delay visual recovery. Additionally, incisions made by hand are not as precise and can affect the final prescription of your eye. And if you have astigmatism, this form of surgery will not completely correct your vision. This often leads to the need to continue wearing glasses after surgery. Femtosecond laser surgery uses a beam of light to create precise microscopic openings and to gently divide the natural lens or cataract into small segments that can be removed without the need for ultrasound. This can decrease the amount of swelling after surgery, allowing for a speedier recovery. Additionally, the laser can treat astigmatism at the time of surgery, which greatly increases our ability to provide you with glasses freedom. SightTrust Eye Institute was one of the first practices in the country to incorporate this amazing technology, and the results we have been achieving so far have surpassed those with ultrasound. By combining laser cataract removal with premium implants, we can provide you with the most advanced procedures for the best vision. Additionally, at SightTrust, we offer the convenience of bilateral same-day surgery, having lens replacement procedures for both eyes on the same day, rather than waiting weeks or months between treatments. This allows for a faster healing period and keeps you from having to return for a separate procedure. I've been performing bilateral same-day surgery for many years now, and nearly all of my patients choose this option. The entire procedure usually takes less than 10 minutes per eye and is performed under mild oral sedation inside our AAAHC certified surgery center, ensuring a very comfortable experience. Patients can resume most of their activities almost immediately. Since their development in 1949, intraocular lens implants, or IOLs as they're commonly called, have been an integral part of cataract and lens renewal surgery. IOLs are small prescription lenses that are made of either acrylic or more commonly silicone polymer. These flexible materials have been designed to be non-reactive in the body, and they do not degrade over a lifetime, which means that the IOLs never need to be replaced, and they can provide you with a lifetime free from cataracts. IOLs are foldable, measure approximately 6 millimeters in diameter, or roughly 1/3 the width of a dime. This small size allows them to fit securely inside the eye without the need for sutures. IOLs have a central round optic disc which contains the prescription and 2 or more projections called haptics, which act like springs to center the lenses. Older style IOLs are called monofocal lenses, just like single vision glasses or contact lenses. These implants provide only one focus point, typically distance, and you would still need reading glasses for intermediate and for near vision. In addition, patients with astigmatism would still require full-time glasses for distance, mid-range, and near vision with a monofocal implant. Toric IOLs have similar characteristics as monofocals, but with the additional benefit of compensating for a patient's astigmatism. Toric IOLs can significantly reduce the need for distance glasses, but full-time reading and computer glasses are usually still required. Monovision focuses one eye for near, while the other is focused for distance. It's traditionally performed with contact lenses, but can also be employed with IOLs. An advantage of monovision is the ability to decrease your dependency on reading and driving glasses without the need for contact lenses. Unfortunately, this technique doesn't always provide full-time glasses freedom and can lead to a loss of depth perception. It's for this reason that monovision correction with IOLs is reserved for those individuals who have successfully worn monovision contact lenses or who have had monovision LASIK in the past. Multifocal and trifocal IOLs provide the greatest range of glasses-free vision from near to far. A series of rings are precisely built onto the center of the lens, which allows the light entering the eye from distant, intermediate, and near objects to come into sharp focus on the retina. I began implanting multifocal lenses immediately after they were FDA approved in 2004, and we noticed a remarkable trend that continues today. Almost 100% of our patients can see at all ranges of vision without the need for glasses or touch-ups. Additionally, 98% state that they would have multifocal lenses implanted again. Patients can drive, watch movies, golf, swim, use their computers, play cards, and read, all without the need for glasses. The latest version of these IOLs, the trifocals, create an even greater range of glasses-free vision. I attribute the success of these implants in our patients to 2 main factors: meticulous testing and measurements by our staff, and careful control for conditions that could affect the rate at which patients adjust to their new vision. Some important steps that help get the best out of these amazing lenses include reading with good lighting, allowing both eyes to work together following surgery rather than comparing each eye's individual capabilities, and keeping the eyes well lubricated with artificial tears. It's common to notice some rings or a glow around headlights and streetlights at night in the early post-operative period. Most patients are not disturbed by these rings, and they tend to improve within several months. If you spend a large portion of your driving time at night, the rings may take longer to resolve. In addition, if you suffer from dry eyes, you may need to use artificial tears in order to achieve the sharpest vision possible with multifocal and trifocal IOLs. As amazing as multifocal and trifocal IOLs are, there are some who are sensitive to halos at night or inconvenienced by lubricating their eyes frequently and may prefer wearing reading glasses. For those, another type of lens provides a range of focus from distance until approximately arm's length. These extended depth of focus, or EDOF IOLs, are a terrific choice, especially for people who don't spend a great deal of time reading. And if you've enjoyed monovision with contact lenses or laser vision correction, EDOF lenses can be focused in a similar fashion. With so many advanced lens technology options available, it's easy to feel confused when trying to decide which option is best for you. Our dedicated team will help you with this process in order to provide you with the best visual outcome you desire. In the next few minutes, one of our doctors will examine your eyes, review your visual goals, and answer any questions that you may have. Even though most patients who have cataracts or are dependent upon glasses or contact lenses are physically candidates for these amazing lenses, it's equally important for us to understand your motivations and expectations in order to better guide you with your decision and to be confident in our ability to help you achieve your goals. It's worth noting that everyone heals differently and at their own pace, some slower than others. Although many patients are able to drive the next day, vision may not seem perfect and may fluctuate. Most patients whose vision is somewhat blurred in the days following the procedure end up with excellent results days to weeks later. It's important to know that about 5% of patients may require a mild touch-up to achieve their best visual results. So, it's helpful to go into the process with the mindset that you may require some fine-tuning, also known as an enhancement, a few months after the procedure. At SightTrust, we are committed to staying ahead of the curve by investing in technologies that will provide you with the best visual outcomes possible. Since the introduction of multifocal IOLs and the femtosecond laser, we've seen visual results and patient satisfaction improve to levels that are unparalleled by traditional surgery. In the past, doctors were happy if patients can see clearer with corrective eyewear after their procedure. Now, with the use of these premium lens technologies, over 95% of our patients at any given moment report to us they can see to drive and read without glasses or contact lenses. While premium lens procedures are associated with higher costs, some may struggle to justify the value of refractive lenses. Let me point out some information that may make this decision easier. The average monthly cost for contact lenses and supplies is between $35 and $50. This represents an annual cost of roughly $500. Since most patients also require a backup pair of glasses every year or two, one has typically spent about $4,000 on optical wear over the past 5 years and will have similar costs to look forward to over the next 5. In effect, you're perpetually financing your vision correction needs. The effects of the refractive lens will last a lifetime, making your investment well worthwhile. At SightTrust, we view lens-based surgery as an art form. I've hand-selected an experienced team of individuals who are constantly striving to provide the finest in all aspects of your experience, including excellent service, unsurpassed expertise, and superior technology. I'm also one of only a few surgeons in the country whose practice is limited to cataract and refractive lens procedures, and who offer the option of operating on both eyes on the same day. We hope that our efforts in guiding you through this process will allow you to see the value in making an investment in yourself and your sight through these life-changing procedures. We know that your eyes are precious, and we look forward to providing you with a level of care and service that exceeds your expectations. Life wasn't meant to be viewed through glasses or contacts. Life is about freedom. On behalf of the entire team at SightTrust Eye Institute, thank you for choosing us for your vision renewal experience. I look forward to working with you.